So we are very excited to have Dr. Karen Fortuna from Dartmouth College and Rob Walker from the Department of Mental Health here today to talk to us about using technology to reduce loneliness and talk about some of the ways that people can connect during this time of uncertainty and during a time when I think many people across the age spectrum and with many different medical problems are struggling with feeling isolated and feeling alone. And they're going to talk about meeting people where they are and how we can use more digital tools to promote these connections. I'm incredibly excited to have Rob and Karen here. They've been tremendous supports to the Engage initiative and to Kelly and I. And Rob is on our stakeholder board, and Karen has been, incredibly supportive. So I'm going to let them take it away. Welcome, Karen and Rob.
I'm just going to quickly also say thank you to Steve O'Neill, who'll be our discussant today from the BI after Karen and Rob present, and just thank him for being so open and helpful and joining us today. And he has a lot of expertise to share in bioethics and in his leadership position in social work. So we'll look forward to your discussion. Now to you, Karen and Rob.
Thank you very much, Steve.
Great. Thanks, everyone. Can everyone hear me okay?
Mm-hmm.
All right, great. So Rob and I we're really happy to be here today. My name is Karen Fortuna. I'm an assistant professor of psychiatry at Dartmouth College, and Rob and I have been working together for the past 5 years now in developing a framework where scientists work with peer support specialists, and peers are people with a lived experience of a mental health condition, and they're trained and accredited by their respective state to provide mental health services to similar others. And we've created this global network of peer support specialists that we have worked with and trained them in research methods and how to develop digital technologies and how to work with scientists as well. And we've also worked with the scientists and training them in how to work with peers too. Our team also includes a group of policy makers as well. And so together, this team of scientists, policymakers, and peer support specialists, we work in equal partnership and develop digital technologies for people with a lived experience of mental health conditions. And so, that's a little bit of the background of, where Rob and I come from. And we're just really excited that we can share with everyone today about how we can promote connection, especially during this current crisis. Rob, I'm going to pass it over to you to introduce yourself.
Oh, sure. Thanks, Karen. So I'm Rob Walker. I work for the state, and I'm here to help. I work for the Mass Department of Mental Health, and I'm in charge of overseeing the contracts for the peer support training. And I work a lot in supporting the peer workforce throughout Massachusetts. And I have a special affinity for older adults and mental health. And I think the exciting thing about this morning, about our presentation, is in a half an hour, we're going to be able to define the problem for you and offer some real constructive solutions on how to solve it. So without further ado, I'll let Karen take it over.
Great. Thanks, Rob. And, we encourage people during this time that many of us are homebound, or, many of us are out there in the field providing services to other individuals. We encourage you to use that chat to support one another. This is a really difficult time for people. And so while we are connected in this environment, let's support one another as much as we can in that chat, and maybe make some new connections as well. So today, Rob and I are going to talk about meeting people where they are, digital tools to promote connection. So we have no actual or potential conflicts of interest in relation to this presentation. And we do have grant support from the National Institute of Mental Health. We also have Patient-Centered Outcome Research Institute support. And I'm also on a NARCED Young Investigator grant from the Brain and Behavior Foundation for the work we've been doing in digital peer support. So for today, we're going to talk about, loneliness and what is the impact of loneliness on our health for people with mental health conditions. And then we're going to talk about how we can get people who are home now access to technology. How can we reach out to them? And then we're going to speak to some engagement techniques. And so while people have access to technology, it doesn't mean that people will want to use it. And so we're going to incorporate some engagement techniques that you'll be able to use right after this presentation to start engaging with individuals. So for the past few decades, the research literature has suggested that people with a lived experience of a mental health condition are disproportionately affected by medical comorbidity, such as cancer, such as diabetes. And they also have earlier onset of disease, and this is due to the accelerated aging process that happens with people who have a lived experience of a mental health condition. And so what happens is that the increased stress in the lives of individuals actually creates a biological environment, a personal environment, where it actually increases inflammation and can increase the level of disease in an individual. So an individual with a lived experience of a mental health condition who has a really high level of stress, who maybe is the age 45 years old, actually has a biological age of somebody who is 65 years old or 75 years old. And so we know that people with a lived experience, they die up to 32 years earlier than the general population. So that's around 50 years old. And so there's been a lot of research for decades and millions of dollars spent on trying to address this early mortality among individuals. And so there's been this development of these amazing self-management programs where it teaches people with lived experience how to take care of their mental health and also their physical health simultaneously. So, after years of having these developed and out there into the community and people are using them, we're still finding that people with a lived experience are actually dying earlier than ever before. And so our team, we thought that, this is the scientific community's response. And so let's talk to peer support specialists and service users and find out why they think there's an early mortality gap. And so we interviewed 40 individuals, peer support specialists, and service users. And we conducted these semi-structured interviews with them. And this interview guide was developed by our co-production team of scientists and peer support specialists. And we asked them, why do people with a lived experience have a shorter lifespan? And what we found was, and this will be out for in the scientific literature published in about 3 months or so, we found that health behaviors are a major thing. So diet, exercise, not living a sedentary lifestyle. And then to our surprise, we heard overwhelmingly people said that loneliness was the reason that people with a lived experience have a shorter lifespan. And if we look at the scientific literature around how we address loneliness with people with a lived experience, it doesn't include this multidimensional model where it includes addressing mental health, physical health, and your social health. And we see that loneliness is where this social health comes in. So, we looked into the literature a little bit further. And, we found that people with a lived experience, they actually have 2.3 higher times the rate of loneliness than the general population. So they experience loneliness more. We actually have a very cool study that we're doing now, and we actually looked about loneliness among peer support specialists, and it was actually consistent with the general population, which was really exciting because we see that as maybe a protective factor for individuals. But it's really important for us to distinguish that what loneliness is. So loneliness is actually a feeling that an individual has. And so people could be geographically isolated or socially isolated right now, living in their homes. And they may not feel lonely because it's an individual experience that somebody has. And so you can be in a room of 20 of your favorite people and still feel lonely. And so it's really important to distinguish the difference between feelings of loneliness and social isolation. Because if we address social isolation, this is geographic. We'll just have more people. We'll have more friends for this individual, but you can still have 10 or 20 friends, but still feel lonely. So it's almost this cognitive thing that people think about. And so that's how we develop targets and how we address these things. So loneliness is this incredibly unrecognized dimension of health and has major implications for cardiovascular health and mortality in all people. And so when we think about social determinants of health, we think about housing. Housing is related to our health. If we do not have adequate housing, that could impact somebody's health. Food is another social determinant of health. We don't have adequate nutrition or adequate food security, we may have poor health. And so these are the social determinants of health. But we call these more multiple dimensions of health if we include loneliness as well. And so these feelings that people have that also impact individuals' health. And so, we find that a lot of individuals with a lived experience of a mental health condition own and use smartphone applications. So about between 80 and 95% of them own and use smartphone applications or smartphones and smartphone apps. And so this could be one way that we're able to interact with individuals, especially in the current, crisis that we're in right now. And so this might be one way that we can access individuals. And we also know that about 95% of peer support specialists own smartphone applications, smartphones and smartphone applications as well. And this might be through their agency or personally, they may own it. And so so the majority of people have phones. So that's a way to actually get information out to people and interventions out to people to address loneliness. But what about the other 20% or the other 95% of individuals that are out there? How can we access them and work through feelings of loneliness with them? So I'm going to pass it over to Rob to talk about some great resources that are available right now.
So I promised that we'd get to some of the solutions of how to overcome this really gap in technology possession and gap in sometimes in smartphone ownership. But one of the things that we've done webinars for audiences of people from across the United States and internationally. And one of the things that organizations in some of the Western states have had success with is contacting their local health authority to advocate for free phones, to get the county board or some of the state departments to pay for phones for people with severe persistent mental illness that are at such high risk. Another available option is that GoToMeeting software is offering free one-year memberships for people that are affected by the COVID-19 emergency. And you could go to the GoToMeeting website and check that out. So in the U.S., so I apologize to the international folks, but in the U.S., there's various free phones for people that are Medicaid recipients or SNAP card recipients. And locally around here, it's through SafeLink Wireless. So if you go to SafeLink Wireless, and it's a short application fee, they check with with the SNAP people or with the Medicaid people to make sure you really are a Medicaid client, and then they'll send you a free phone. And most states, they're now Android phones. And also, the United Way has a COVID hotline, and I understand that it's been pretty busy. But the way to do that is to call 211 and ask United Way for extra phones. Okay, the next slide. So there's also free data plans on smartphones for people that already have it. So companies like Comcast, Sprint, T-Mobile, and AT&T are offering additional mobile hotspot. They're unlocking all their mobile hotspots so anybody can connect to the internet. They're offering unlimited data on their phone, and the Lifeline partners like SafeLink are offering more data for the phone plans. The Charter Communications, again, I apologize, this is US, is offering free Spectrum broadband and Wi-Fi to households with kids in grades K through 12 and college students, so they can interact with with their school and their education. And then the free Wi-Fi hotspots. And finally, also in home internet, that Comcast, which is ubiquitous in the United States now, is really offering 2 months of free high-speed internet, no credit check, no shipping fee, or no contract for the service, and they'll supply you the modem for free. So there are options if you ask and you look.
Great, great. Thanks so much. Thanks so much, Rob. And so I just want to talk about, the importance of bonding right now and the connection with individuals. And so, we talked about loneliness and that it's this feeling. And so biologically, as human beings, we needed connection and bonding with other people, in early days, because we needed this bonding and connection to access food, water, safety. We lived in these communities. And now with technology and all of our advances, we don't need to live in communities anymore, but we still need people around us, this bonding and connection, real, true, authentic connection with individuals, because that is related to our safety. And so, we're going to go through a few engagement techniques around bonding and connection, even though we're using technology. But first, I just wanted to note some really amazing things out there that can help people address those feelings of loneliness. And so one way to address that is through, focusing in on an individual's sense of purpose. And so between sessions, if you're doing, meeting sessions with an individual, what can they do for themselves to empower themselves, and so they can address their feelings of loneliness? One really cool thing they can do right now is volunteering. There's a lot of programs across the world right now, and one that I particularly I like because it's part of this AmeriCorps program, which I was a part of years ago, but it's called Retired Senior Volunteer Program. And so now older adults in this specific program, they can be on a volunteer phone network. And so they can call other older adults who may be experiencing feelings of loneliness and talk with them overnight and have discussions with people. And so one way we can do this is increase a person's sense of purpose, and doing so could be through volunteering. Another thing that we can do is, since we are really all in this together, we can foster partnerships with other people. So if you're an advocate, a peer support specialist, psychiatrist, social worker, we can all be advocates right now, and we can reach out to our local resources to foster partnerships. And so one of these partnerships could be with people who are Meals on Wheels individuals who are dropping off food to homebound older adults, and working with them to check in on some people that may be, you know, especially vulnerable. Or maybe when they go, you can have them print out a piece of paper and leave it on somebody's door to say, hey, you know, we're having this group at 10 a.m. today on the telephone, you know, please come and join us. And could be information transmission. Other places, other states are using working with the police in their local state, and so they're checking in on older adults. And so think about this, you know, fostering these large relationships. And some of the things too are, you know, what if people have technology but they don't know how to use it? And so there's an amazing resource out there which I believe is international. I'm going to type it in the chat right now. It's called COVIA, COVIA. And yes, Kelly, that is definitely fine. So this is, if you look this up right now, it actually will set you up with technology training resources for individuals. And so if people are using telephones, you know, maybe you want, you're providing services through the computer. And so you want to encourage people to learn how to use computer and Zoom to maybe connect with their friends and family. So COVIA is offering free training for people as well. And, you know, another thing that you could do too, and Rob, I'm going to ask you, you know, in the interest of time, that we'll end the presentation on one technique that you have learned, storytelling, and one technique that you have learned in your experience with that and how to address loneliness among older adults through the use of storytelling and helping people reclaim their story as some kind of a technique that people can do to help engage with technology and how to address feelings of loneliness. So Rob, I'm gonna pass it off over to you, and if you just walk us through, you know, your experiences with storytelling as a way to address loneliness.
Sure. So one of the coolest things I've ever heard about is a program at the VA, the Veterans Administration, called My Story, My Life. So to keep it quickly, so it's in the Boston area, they have students. So what the student does, the med student or the OT student who's an intern, what they do is they interview the veteran. It's a semi-structured interview and ask them to tell their story. These are usually people that are there for palliative care or for long-term care. So the veteran tells the story. The student writes the story and then gives it back. They go over it with the veteran after the story's written, and they, if the veteran agrees, it goes in the medical record. So the treaters can now read the story in the medical record. So to get an idea of the veteran as a whole person rather than just a bunch of symptoms or a bunch of lab values. So there's a couple stories of one veteran who was a Vietnam era veteran. They went over his story. He asked for about 20 copies of the story, and he handed it out to his family members when they came to visit. And the family members were blown away because they said, we were told never mention Vietnam, never talk about Vietnam among dad. So nobody knew the rich story of this veteran because nobody asked. And then finally, there was one other med student that was there, and somebody asked her if she had read the story of the veteran she was working with that day. And she said, no, I wait until 4:30 because I can go into my office with nobody else around, and I can read the story and cry in peace about how amazing individual is. So I think making sense of your life through story is something that we don't think a lot about with older adults, and that's an easy one to do remotely also.
Mm-hmm. That's great. Thanks so much, Rob. And so that's one way that, people who are non-licensed or even licensed can work with other people to address these feelings of loneliness. So we want to thank everyone, and looks like we're asking people now how people are feeling. And so there's a survey now, that has been put up on your screen. And so, please feel free to complete that. And so this is a survey now asking about your feelings of loneliness. And so we want to thank everyone, and we want to pass it over to our moderator, and so we can walk through some questions. Thank you.
Thank you so much, Karen. Hi, Steve.
Hi, Kelly. I don't think you can see my, oh, you can you see my screen?
You look great. Thank you.
Okay. All right.
Thanks for being with us. I want to just use the time for you guys.
Great. So, and I want to make sure that I'm respectful of the time. So we've only got a couple of minutes really, and I do want to take the liberty to kind of talk about a major tool that I think that all of you would be good for all of you to hear about. And that's a program that I work in Open Notes, called Open Notes. And Open Notes, we're not selling a product. It's not anything at all. It's simply, if I take what Rob said about the narrative approach to healthcare, that it really is, Open Notes means that patients have access directly to their medical record and everything in it. So everything we can see as providers, they can see. And we started this many, many years ago at Beth Israel Deaconess Medical Center. And we have expanded that 6 years ago to include mental health notes. So we include all of our therapy notes. And this is a great tool for getting folks stories. The VA that Rob mentioned just a minute ago is a VA out of Madison, Wisconsin, that has published the data, by the way, about the use of narrative stories for patients to inform them. But we don't think about the medical record itself as actually being a narrative for our patients, and it is their story. And so Open Notes, patients have the right to access to their record, and all Open Notes does is we're just greasing the skids to make it very easy for them to have access to it. So currently in the US, yeah, Kelly? We have 46 million patients in the US that have access to their record directly. And we have a little over 60 networks, health networks in the US and Canada that have opened up their mental health notes. Most mental health practitioners are scared silly that this is going to be a huge problem for their patients. And for us, it'll be more labor intensive. It'll create more problems. None of that has borne out. And in fact, actually, what we're seeing is that it lessens the stigma for our patients coming in, that they're able to see it, they're able to better handle it. And if you think about patients with cancer, for instance, a cancer diagnosis who also struggle with anxiety, it is so hard to hear and take in whatever they have in the best of circumstances. I will say for myself as a parent, in a personal way, 2 of my children are cancer survivors. And I will say that the first time, and I teach in bioethics and teach informed consent, the first 4 or 5 conversations that I had with clinicians after our daughter's diagnosis in particular, the first child, I couldn't hear anything that anybody was saying. And I remember my own anxiety was so prevalent that it just got in the way of hearing things. And that was true for my wife as well. We just couldn't take stuff in. And so I think opening notes, I would ask all of you to think about that as a tool to help bridge the divide for our patients, to engender trust and better engagement. And on our Open Notes website, we have all of our publications. We have a mental health toolkit specific for the mental health population that's there. Anything that's there can be plagiarized. There's no fees on any of this. You can just have whatever's there, tinker with it, adapt it in your own institution. So I just would mention that as an outset. I'll do one question for Rob and Karen, and that was a question that I think about with the population you're talking about, and it came up in the chat room too, is distinguishing between aloneness and loneliness. That if you could help us think that through a little bit, because sometimes people think loneliness will just simply be solved by being around other folks, but Karen gave a great example of someone could be around other folks, including those that care about them, and still feel tremendous loneliness. And I wondered if you had a way to think about and distinguish that in your way.
Yeah, that's a great question, and that's why we're trying to speak to the difference between being socially isolated and then but still feeling this feeling of loneliness. And so when we think about that, a lot of people are socially isolated now, but we can do certain things to help them work through feelings of loneliness. We suggested promoting volunteering among individuals. Rob spoke to storytelling, or in a clinical term, that's actually, actually a clinical term for that is narrative therapy. For individuals, there's also a way to foster partnerships for individuals too. And so people can actually challenge those thoughts of loneliness. And so if you are a clinician too, one way to do that is through acceptance and commitment therapy. There's research to suggest that that is a way that people can work with others to really retrain their mind to challenge those thoughts. For peer support specialists, if we're with us on the call too, fostering relationships and shared lived experience may help. Actually may not help out. It does help. We actually have a research study now that we're quantifying the results, and we're finding that peers providing their shared lived experience with other people is showing a decrease in loneliness among service users, which is really exciting research that will be out in the next 3 months. Rob, did you have anything to add to that?
Well, I also think, especially with older adults and with people of all ages with mental health challenges, that really the loneliness, part of the loneliness is loss of life roles. Yeah. That there's no more meaning in life. Mm-hmm. The only meaning left is being a mental health patient, or in cancer, a cancer patient. I don't work anymore. If I ever did, I can't do the household stuff. So part of what peer support can do, and part of what all of us can do, is help people find meaning in their life and connect with it. And I also think Kelly brought this up too, that the PHQ-9 or PHQ-8 partners, but PHQ-9, the scales may not pick up on that in older adults, the loneliness. So so some of our screening tools even are not accurate enough to pick that up.